Congress now preparing to merge the House and Senate versions of the health care overhaul. And polls show that Harry Reid's bill lacks popular support, but it may have perhaps a bigger problem. It may not be constitutional. Senator Orrin Hatch lays out the case in a Wall Street Journal editorial written with Ken Blackwell, who is a senior fellow with the Family Research Council. He's also a lawyer. Ken Blackwell joins us now live from Cincinnati. Thanks for being with us, Professor. You argue that Congress doesn't have the constitutional power to require Americans to buy health insurance. Well, how about Article 1, Section 8, which gives Congress the power to regulate commerce among states? The Supreme Court, as I understand it, has interpreted that to mean any activities that substantially impact commerce among the states. Isn't regulating healthcare markets interstate commerce?
No, it isn't. You know, this turns the Constitution on its head. It does it in three ways. First, the individual mandates actually take away freedom of choice by individuals, moves the emphasis from individual in the marketplace to state mandates.
Right.
It mandates and commands the states to actually buy into these exchanges, and if they don't, the Secretary of Health and Human Services is given the authority to be the new czar, and thirdly, it is unconstitutional because it violates the General Welfare Clause, where it in fact has used.
Let me stick with the Commerce Clause for a minute, and then we'll get to the general welfare. The failure to buy health insurance affects all of us in a couple of ways. First of all, taxpayers have to reimburse hospitals who, by law, are required to give care to the uninsured. And second of all, unreimbursed expenses drive up health care costs. That's passed along to the insured with higher premiums. So, I mean, Professor, doesn't that substantially affect commerce in all 50 states, and thus Congress is empowered to do something about it?
Well, all of the constitutional lawyers that I've talked to, Greg, says that this does not meet the definition of the Commerce Clause.
Did you talk to Erwin Chemerinsky, professor and dean of the UC Irvine School of Law? He says it's perfectly constitutional.
Well, he and other constitutional lawyers are battling that out. It would seem to me that Madison, one of the framers of the Constitution, probably got it about right, that if, in fact, the Constitution does not mention it, it is not within the purview of the federal government to mandate it.
There's lots of stuff that's not mentioned in the Constitution. In fact, you brought up the General Welfare Clause as a reason why it's unconstitutional. Let's talk about that. I mean, doesn't Congress have broad powers to tax and spend for the general welfare? In fact, in the last 70 years, no tax and spend program has been declared to exceed the scope of Congress's power. Well, Medicare, Medicaid, Social Security, all three.
Let's talk about that. How did they get there? They got there through cloture, and they bought off individual citizens, senators, and in this case, the benefit is for a narrow interest. It does not serve the general welfare. I think any simple and clear-minded analysis would say that in fact, did injustice to any practical consideration of the welfare clause, general welfare clause.
You argue, and you mentioned this just a second ago, you know, that deals were cut to secure the votes.
Yes, sir.
And you've argued in your op-ed that runs afoul of the Constitution. Well, Professor, doesn't nearly every spending bill in Washington do precisely that? I mean, my goodness, earmarks are slipped into just about every spending bill. That's selective spending. It advantages some states and disadvantages others, doesn't it?
Well, you're a lawyer, and I would suggest that in this case, this is a prime case that should be advanced to the Supreme Court to make a decision. Mm-hmm. Let's say that there are things that have gotten under the bridge. It is now time for us to put a stop to it. this bill would, in fact, commandeer 1/6 of the nation's economy. It would turn the Constitution on its head by shifting power away from the states to the federal government, empowering the central government in a way never envisioned by our nation's founders.
But look, we do that with Social Security. We do it with Medicare, and my goodness, Medicaid has been foisted on the states. They run it. It's a federal program. They got to pay for a lot of it as well, though they do get, federal subsidies. If that is constitutional, how is this new reform bill proposed by Harry Reid not?
Greg, I would make this argument. Now is a time to draw the line in the sand. I think this is a clear case. The 3 issues that we lay out in our Wall Street Journal commentary, I think have substantial meat on the bones to move forward on a constitutional challenge. I think instinctively people across this nation understand that this is a bad deal. Yeah. But the Congress is not listening. They're going to ramrod this through. Right. I think the only second line of defense will be the courts. Sure. And the arguments that we make are not without not without opposition.
Yeah, and let me say, they're great arguments. And I happen to agree with them. I just couldn't resist challenging you on them. Thank you very much for being with us.
It's good to be with you, Greg.
And you're a good sport about it, too.